I'm a clinical psychologist, and I'm an alumni of USF. So I went to USF, I got all of my degrees there, including the PhD in psychology. And when I was there, as you might know, when you're getting a doctorate degree, you have to do research. And my research at that time, back in the 70s, a big area of research was obesity. So I started out with doing a treatment study for obesity. In order to do that, you have to advertise for subjects to come in and want to be in your study. So I did that. And the interesting thing that happened was that I got some people coming in, even though I was asking for people that were 20% or more overweight, I got some people coming in that were not overweight at all, but they thought they were 20% or more overweight. So that was very interesting to me. And that led to me taking kind of I was still interested in obesity and did research on it, but I became very interested in eating disorders such as anorexia and bulimia. And I started working as a staff psychologist at USF, working with students with eating disorders. And I also had a private practice that I did for a number of years, working with anorexics and bulimics and compulsive overeaters. So I have a lot of years of experience dealing with the extremes as well as, the everyday type of food problems. As time was going on and I was treating eating disorders, I was also observing the general population. And what I was seeing, and by the way, I'm from the era of Twiggy, back in the 60s and 70s. So I was in high school and junior high when Twiggy was around, and all of the little girls wanted to look just like Twiggy. And you were willing to do anything to look just like Twiggy. Well, it was at that time that this whole thing with fad dieting and eating disorders really started to take off. Okay, so that gives you a little bit of background. But anyway, as I was working with eating disorders, I noticed that our culture in general was becoming more and more preoccupied with weight and food and appearance, body image. And I started to think that it wasn't just anorexics and bulimics anymore that had an eating disorder, but it seemed like our culture was having an eating disorder. So that's when I decided to write my book, Mind Over Fat Matters. And it's really directed at the general public, but it brings in a lot of what I know and what I've used with all types of eating problems throughout the years. So that gives you a little bit of background.